Uh, hello, and good evening. So today we are going to talk about what kind of the problems we are facing in
Trent?
this pandemic, in point of view of kidney patients. So we all know that kidney is a disease that has its stages. There is a stage in which kidney function is deteriorating and the patient is going towards dialysis. Then there is a stage on which the patient is on dialysis, and then there is a stage when the patient uh, has got a kidney transplant. Unfortunately, coronavirus, COVID 19, as we all know, it is a household name now, and everyone in the country, in the world, has been affected by this virus directly or indirectly. So, all our kidney patients in all the stages, they are immunosuppressed, means their immunity is weak. When the patient's kidney is deteriorating slowly, then the immunity is weak because of the disease of kidney disease. Chronic kidney disease lowers the immunity and it affects our immune system, and our ability to fight the diseases is not as good as the people who don't have kidney disease. And when someone has got a kidney transplant, then the problem is immunosuppression. Those medicines which are meant to protect the kidney, they reduce the immunity as well. And it is a kind of common sense that when the immunity is down, and then of course we are more prone to the disease. And if someone with poor immunity gets the disease, then there is a likelihood that the disease will be more severe in these patients. And these patients, they are weak as well, nutritionally weak. So whenever they get the disease, it is difficult for them to come out of this disease as compared to the people who don't have kidney disease. So, what kind of precautions one should take when he has a kidney disease in relation to coronavirus? So, first of all our one what we call it COVID appropriate behavior, it must be followed by everyone, but then you are yourself most responsible for the safety measures. So, all kidney diseases, the kidney disease patients, I'm sorry. So all kidney patients, they must really follow COVID appropriate behavior in its letter and spirit. Mask, sanitizer use, and try to reduce the socialization to the minimum. To go out only when it is really necessary, and their family members, because if someone in the family catches the coronavirus, then there is a likelihood he will pass on to the patient as well. So even the family members have to follow a COVID appropriate behavior. That is the best thing. Prevention is cure. Then vaccination, most important. All the vaccinations which are, I will say, in circulation in all parts of the world, they have been taken by kidney patients, including post kidney transplant patients, and including the patients who are on dialysis, and those kidney patients who are yet not on dialysis. And these vaccines have been largely found safe and effective as well. So, yes, everyone, everyone, uh, be it a kidney patient or not a kidney patient, must be vaccinated. But the kidney patients themselves make extra effort to get themselves vaccinated. In fact, when the vaccination was started, our kidney patients, post transplant patients, were prioritized by the government as well. So, along with that, their family members. So, uh, if the family members are vaccinated, near and dear people are vaccinated, patient is vaccinated, so there will be uh, lesser chance of contracting the virus. And what we have seen, and it has been published as well, if a vaccinated person gets COVID infection, then the severity of the illness is far less as compared to the unvaccinated. So vaccination helps you to avoid infection, and it helps you in the way that even if you catch the infection, there is a likelihood that the infection will be mild and it will not be as severe. So vaccination is a must. Everyone should get vaccine. Only there is a very rare segment of the population in which vaccination is contraindicated. So, of course, before going for vaccination, all kidney patients must get in touch with their nephrologist regarding the appropriateness of the vaccine. And once the person is vaccinated, getting a antibody titer is important. That helps you to know that, okay, whether the vaccine's antibody level is now protective or not. So that's vaccination. Now, the second thing, if someone has got a COVID infection and he is a kidney patient, so what kind of precautions he should take? First of all, the biggest mistake the patients do, kidney patients, is the self medication. So, all kidney patients must avoid self medication. So, they should contact their nephrologist. He can guide according to the severity of the infection, severity of the symptoms. In my personal practice, most of the kidney patients, they don't require, I will say, a lot of super specialized kind of COVID care. If the disease is mild or moderate, they can be taken care of at home. And I have, I will say, took care. I did take care of, I will say, hundreds of COVID patients who are having kidney disease, both post kidney transplant and non kidney transplant. And whenever the patient's condition seems to be deteriorating, then the nephrologist can guide them to go to the hospital. And but um, there are, I will say, more than 90% of the kidney patients can be treated at home, but they must not self medicate. Self medication is the biggest problem. And once they have the kidney disease and COVID infection, the treatment should be taken completely. All the required investigations must be done. Sometimes the after the coronavirus has been treated, there can be sequelae, I will say, after effects in the lungs. They must be taken care of. They need physiotherapy. All those things, I will say, a proper treatment must be taken. It should not be taken lightly. Most of the diseases are mild and the people don't have sequelae. They get well, I will say, without, I will say, hospitalization. They can be taken care of at home and they don't have problem in the future. But if they have, then it's very important that they are treated adequately. And the proper COVID treatment helps you to avoid the after effects of COVID as well. And then our kidney transplant patients. If a kidney transplant patient gets COVID infection, first of all, he must get in touch with his nephrologist immediately. Sometimes we make some adjustments in their immunosuppression, uh, depending on the severity of the infection and the appropriateness of the situation. So that advice must be followed very diligently. And uh, I will say, once the infection is taken care of, further follow up is required. And during COVID infection, particularly, they can require steroids. So if they require steroid, there is a possibility the sugars may go up. So the sugars must be checked regularly. Blood pressure can go up or go down. That must be followed up and treated adequately. And then, of course, as all of us know, oxygenation, that must be, I will say, first properly, I will say, monitored. And then, if there is any issue with that, it should be taken care of. Mostly, um, patients don't require oxygen, and if they do require 1 day or 2 day small amount of oxygen, that can be taken care of at home as well. And the patients and their family must be in touch with the hospital as well, that if there is a deterioration of situation, the patient should be able to be hospitalized as well. So all these things must be taken care of by, I will say, the whole society. It is only a kidney patient cannot take care of himself. We all must be taken care of him. All means we as a doctor, nursing, family members, patients, friends, everyone must contribute. So when we say contribute, the first thing is that we all follow a COVID appropriate behavior, and then vaccination. If the more the number of people in the society gets vaccinated, the earlier we will be able to defeat this disease. And then most of I will say pharma companies, they have been trying to help the patients when they get COVID infection in their own way to the best of their ability, and we must I will say applaud them about that. And again I will be saying that COVID is an infection in which we, if we are careful, we can avoid it. And then if anyone gets it, it can be taken care of, and the most of the cases are mild. But we all must take it seriously. It is not something because these days, the moment this second wave has gone, we all see around us people are not using masks. They are really casual about the social distancing. So I will seriously think that all of our all of our patients, society, their family members must contribute, and we must follow all appropriate COVID related behavior. And then most of our kidney patients ask us that what else can they do, like government says about Ayush, Kada. There is no problem with that. Patients can take, and then I always recommend patients to take proper yoga, Pranayam is very good because it's a kind of physiotherapy of the chest, and the breathing volumes of the lung, tidal volumes, they are appropriately built up by yoga and pranayam. All kind of yoga, all kind of pranayam are allowed for the kidney patients. There is not a problem. They must try to reduce the hospital visits. Um, we allow patients to seek advice by video consultation or teleconsultation, and they must come to the hospital only when it is really necessary. And unrequired, I will say, casual hospital visits must be avoided by the patients. And then some of my patients, they when they need transplant, they ask us that in point from point of view of COVID whether they should get a kidney transplant or not. We have been continuing with the kidney transplant because we feel that patients who are on dialysis, they have to come to the hospital so frequently, so the chances of catching COVID is very high. So if someone is appropriately vaccinated and the antibody level and everything is good, so patients should be encouraged for kidney transplant when possible. And we, I will once again say, we are in this all together, and we must help each. I will be very happy if patients ask me any question. This is a live session which the recording will be run, and accordingly, the questions can be, I will say, put on the Facebook, and they will be answered. I will be very happy to do that. And once again, thank you to our Ready Lab. Uh,
So there are questions in the
yeah,
tab.
please. I will be very happy if they ask questions. Can diabetes patients are more prone to chronic kidney disease? That is the question. Yes, diabetes patients are more prone for chronic kidney disease, particularly those diabetic patients in which the diabetes is not well controlled. There are certain factors, but all diabetic patients, they are more prone to chronic kidney disease as compared to the normal population. And in this world today, diabetes is the number one cause of chronic kidney disease. So a diabetic must be very careful regarding his kidneys, and a because in India there has been an epidemic of diabetes. The number of diabetic patients has gone up really high in recent time, and that has contributed to high number of chronic kidney disease patients as well. So yes, diabetics must be very careful. I agree. Any other question? What is the lifestyle we need to follow when we are young to avoid diabetes and CKD? Okay, so when we say lifestyle, uh, first of all, we must understand that diabetes has some hereditary component as well. So by having this lifestyle, what we have seen that even if you are not able to avoid diabetes altogether, it is possible that the diabetes to a person with very good lifestyle will happen later in the years as compared to a person who is hereditary more prone to diabetes and has a very poor lifestyle. He will contract diabetes early, and when he has the diabetes and if he still continues to follow poor lifestyle, then there is a very high chance that he will progress, he will get chronic kidney disease, and such chronic kidney disease will progress very fast. So the lifestyle required is number one, avoid weight gain. Obesity must be avoided, regular physical exercise must be taken, and there should be a, I will say, rhythm of the body must be maintained. Means person must get out of bed at appropriate time early in the morning relatively, and must go to bed in time in the night. It should not be that there is no rhythm and the person sleeps at 2 a.m. and then wakes up at 11 a.m. These things are never healthy. And in the diet, uh, all, I will say, particularly the salt must be kept low, because salt uh, is a cause for chronic kidney disease in itself. So if you are taking regular exercise, you are avoiding obesity, and then you are getting your health checkup regularly, uh, for diabetes, hypertension, then there is a possibility that we you may be able to avoid diabetes. And then even if you get diabetes, it may come much later in the life. Next question, please. Which is the best vaccine for elderly people because Covishield is causing. Uh, I will say our experience with Covishield has been excellent, and although the media that we show share and media shows these case reports, but the Covishield has been very effective vaccine as well, and number of cases uh, with these blood clot problem is very few. So accordingly, almost every country and its government has issued appropriate guidelines, and that which category of the patients should get what kind of vaccine. In our country, government has allowed Covishield to the patients who are more than 65 years, and we have not. I have not encountered a single case of with blood clots post vaccination in chronic kidney disease patients, or even in patients who are not having kidney disease. And even in my social circle, personally, in my relatives, my family members, I have never even heard anyone getting this problem. So I will say at this moment, vaccination is far more important, and these cases are very few. So one must not be very, I will say, afraid of vaccination, and we must follow our government's guideline. Government is there to take care of us only. So if the government allows a 60 more than 65-year person getting Covishield, so I won't say that it is against recommendation. Next question, please.
I guess sir, this is the last question.
Okay.
Thank you, sir.
Thank you
Thank
very
you for
much.
your valuable
I,
time.
Yeah, all our audience asked very, I will say, nice and intelligent questions. I am very happy to answer them, and it really shows that our public is very intelligent. They always ask appropriate questions, so they must be provided a platform on which they can ask questions. So I'm happy that you people are making this effort that patients can be given right kind of knowledge, because the biggest problem with the COVID is there is too much of misinformation. Almost everyone is suggesting something or the other to other person, whether he is a trained doctor or a healthcare person or he has experience with COVID or no. So I am very thankful to you people for the effort and for the social service you are doing. Thank you.
Thank you, sir. Have a good day, sir.